Good morning, everybody, and welcome to the Council of Governors Representation Committee for this month. We have a few apologies. Karen, would you like to note the apologies?
If it's okay with you, Sharon, I won't read them out. I'll just ask Sam to make a note of them in the minutes, if that's okay.
Absolutely, yeah, that's great, thank you. We don't, as far as I'm aware, have any declarations of interest. So if anybody wishes to declare an interest that isn't logged, please put it in the chat bar. Thank you. So we go on to the draft minutes of the Council of Governors Representation Committee meeting, which was held on the 24th of April. Could we go through those for accuracy? Are there any points of accuracy? I'm not getting any, so we're going to accept those as an accurate record of the meeting. And now move on to the actions from that. There were only two actions from that meeting. One of them is complete, and the other action is still in progress, which is the Better Together membership magazine, and that action is ongoing. Do any committee members have anything they'd like to say about the action? No. Okay, so we're receiving those actions. Jo, you've got a comment.
Yeah, just to say I haven't caught up with Laura, but we can squeeze it into this next edition. So I'll be making contact with her in the next couple of days just to make sure we can get that in this next edition of Better Together.
Okay, that's helpful, thank you. And just to note that we do have apologies today from Kevin, who isn't able to join us. But we're going to move on now to one governor's experience, and we have Amanda Whitehead with us today, who's going to take us through her experience. Are you there, Amanda? I can't see you.
Yeah, I'm here.
That's lovely. So I'm going to hand over to you. The floor's yours.
Thank you, Sharon. Hi, everyone. My name's Amanda Whitehead, and I'm a General Carer Governor. I'm sharing with you today why I became a governor. Back in 2020, my youngest daughter was admitted to a psychiatric unit, something that we'd never actually experienced before. She'd struggled with mental health for quite a few years, but after asking for help for quite a long time and us being told that she didn't really, or the NHS didn't have any support that they could give her, she became quite ill and was admitted into the unit and put under a Section 2. This went on for about 5 or 6 months, and then in 2021 she was readmitted. We went through quite a process where she wasn't treated very well. We weren't particularly listened to as her family, and when she came out, I'd been told quite a lot that I needed to research her diagnosis, which was borderline personality disorder, and if I didn't do that, I wouldn't be able to actually help her and support her in the way that she needed. So I did lots of research, really understood the diagnosis, learned how important communication and the language that we used with her was, but also understood that it was difficult for her to communicate as well. So when she came out of hospital in 2021, I asked if there was some sort of communication therapy that we could have as a family. And we were introduced to a lovely lady called Donna Bradford, who came along and went through things with us. And one of the weeks, she wanted to see how much we understood about Ellie's diagnosis and help Ellie understand where we didn't know, or where she needed to communicate more. And when I was actually explaining it, Donna asked me if I would become a governor, something that, if I'm honest, I didn't even know was a thing. So she introduced me to Shana, and we went through things, and I decided to go for it and became elected. So my experience as a governor, really, I feel like I could have done more. I was quite excited when I was elected, and there was opportunities that came up, but unfortunately for different reasons they got cancelled. So things like opportunities of running clinics with Sarah Connery, so I put my name down for that, but unfortunately it got cancelled. Doing the 15-step tours, I put my name down a few times and each time it got cancelled. And then the opportunity of visiting the new units, which again got cancelled for different reasons. And when the date came that you could go around, unfortunately I wasn't available. So I feel like I have more to offer, but I'm not really sure how I play my role without having those opportunities. I know there is a carers education call, and when I am available I do attend those, but sometimes I'm not available. And I think for me as well, I had up until this week I had lack of clarity of the declaration of interest, because I feel I have a lot to offer around education of health and well-being. And I'm very passionate about a more holistic approach. So my reason for becoming a governor was to create that positive change for everybody, carers. But obviously, if we can teach people how to look after themselves, then that's a lot easier on carers because they're not worried about their loved ones quite as much. And so, yeah, I think really my feedback today is that I could offer more or have a more positive impact by using my strengths and finding a way to become more visible, so I can actually connect with more carers and get their feedback and then be able to relay that in the council meetings. And I suppose one of the things that I do struggle with sometimes is I care for LA. She now has a little girl who's 8 months old, which I'm very, very grateful for. But I also help look after Isla a lot, and also look after my mum, who she's not actually in Lincoln, she's in Sheffield, but she had a stroke and she's had a few falls, so I help my dad with her as well. So it's not always possible for me to join the calls, so sometimes I'm not able to give as much as I would like to. But we're all under a lot of stress, we all have things going on. But yeah, that's really in a nutshell why I became a governor, my experience of it, and what I would like to be able to give to it. Thanks for listening.
Thank you, Amanda. I'm going to open that up to questions from members of the Representation Committee. While we're waiting for those to come up, I just had something I wanted to talk to you about, which is, you know, the issue of having more to offer, because I've recently had a conversation with the lead governor regarding, you know, we have a wealth of experience and knowledge within our governors, and I think organisationally we don't always play to the strengths of our governors in those areas. So, you know, you identified there the areas of interest that you had, education being one of them, one of the areas of experience that you have, and I think, you know, moving forward, I think what we'd like to explore as an organisation is gaining more understanding of each of our governors and what their interests and area of expertise are, so that we can play governors into the different kind of agendas of the organisation, you know, because that would add so much value. So that's really something of interest that really we've only just started talking about. So thank you for that, Amanda. So Beck says, congratulations, it's not easy to talk about things, but I'm going to go now to Jacqueline, who has a comment for you.
Hi Amanda, I'm Jackie Tyson. I'm actually the business manager in the Older People and Frailty division, but I'm also a staff governor, so hence being here. And you're not alone in feeling that you could be doing more and should be doing more. I think it's a conversation I hear from all our governors. It's a fine balance when you're working and you've got care responsibilities. But I was really interested picking up on what you said about looking after your mum as well. And we have a lot of opportunities in older adults to support with care activities. We have our own little stakeholder group. If you're happy to, I'll email you, and perhaps you could. A lot of them are virtual, which might fit in better with your lifestyle as well. So if you're happy to get involved in some older adult carer type activities, I'd love to get in touch with you.
Okay, my mum's not actually in Lincoln. I think I said that.
No, that doesn't matter. You have experience of caring with older people, so your comments will be more than valid. Lovely, thank you.
Happy to have a chat.
Sharon, you're on mute, sorry.
Had to happen, didn't it? Lucy has a comment for you, Amanda. Lucy's having trouble unmuting her mic. I don't think there's a way to help you there. Do you want to put the comment in chat bar, Lucy, and I'll read it out if that helps? Right, so right, okay. So Joe's just said there's a mic button top right of your screen, Lucy. You might need to press it. Okay, it's not working. Right, so until Lucy. Oh, there you go.
Something must have changed, because I was getting a message up, so I don't know what's just happened there, but anyway, we're here now. It was really just to say, Amanda, first of all, I really apologise. I've got really poor hearing at the minute, and I didn't actually hear what you said your daughter's diagnosis was in the end that she was given.
Well, she was given two. She was given borderline personality disorder and emotionally unstable borderline personality disorder, which, since researching it myself, I now understand is the same thing. It's just the language that's used different. So yeah, she was borderline personality disorder.
Thank you, I appreciate that. That's just really helpful to build context. To be honest with you, the other guys have already said what I was going to say, and that was, first of all, don't beat yourself up. I mean, I've been in post since mid-2022, and I've been in a similar position to you where, you know, things have been, you know, advertised and cancelled beyond other people's control. And I recognise that that is really frustrating to happen. And I too was looking forward to going on that ward visit, and then it came through on a day ultimately when I just couldn't do it. And it is really frustrating, but try not to let it, you know, sort of hinder you or get you down. There will be other opportunities. Yeah, like other guys have said, it's just a really busy world that we're all living in. I understand what it's like when you're a working mum, when you're caring for other people, and you know, you need to prioritise, and first and foremost, no matter what day of the week it is, it's you that you have to look after the most in all of this. There will always be further opportunities, and that's kind of all I wanted to say, really, if I may.
Thank you.
No, I'm having.
You're on mute, Sharon.
Yeah, I'm having trouble with my mute as well. Lucy's right, Amanda, and of course we've had a number of issues, reasons why we've had to cancel visits. I mean, some of the visits have been cancelled because, you know, of the COVID, and staff, obviously, and patients, you know, getting COVID. So it has been a difficult time to plan some of these kind of visits, but hopefully moving forward it'll be a little more organised around that, and you will be able to join in. So I'd like to thank you for giving your story. It's been, you know, really helpful today for us to kind of contextualise, you know, the value of our governors. And I wanted to make sure with Karen that we did capture that action around, you know, understanding our governors' knowledge and contributions, so we could map them to the different events that we had. I'm not quite sure how you'd capture that as an action. But do you get what I mean, Karen? Yes,
Hi,
Karen.
Hi, Sharon. Yes, thank you. It might just be easier for me to mention now. Yes, absolutely. We'll ensure that the minutes are capture this appropriately. And if I might just make a comment about what's been discussed, we do really value what governors have to contribute, and I don't want anyone to go away today and think that, you know, they've signed up to be a governor and actually we're not utilising those talents and those experiences. So as most governors will know, and hopefully have done by now, completed the Council of Governors appraisal. That's a really rich source of information for things like that, because there are statements in there that we ask governors to respond to about what they can bring if we don't already know. So I'm hoping that that will actually also provide some further information on that. But I will work with Sam, our Governor and Membership Officer, to ensure that we focus on this particularly and try really hard where possible not to let people down. It is usually beyond our control, but to ensure that you have the opportunities that you're looking for. And yeah, we can maybe revisit this in other fora in the future. Thank you, Sharon.
Thanks, Karen, and thank you, Amanda.
Thanks,
I don't
Sharon.
have.
Sorry, can
carry
I
on.
just say, I totally understand how busy everyone is. I always put my own well-being first and foremost. That's really important to me. But I also understand I do sit on different boards, not as governor, so I hear the same kind of struggles and things all the time. So I totally get it. It was really just sharing my experience of how I feel that I could maybe contribute more within my role. That's all.
Yeah, thank you. Thanks. So, and if somebody could get a message back to Donna Bradford, maybe Karen, to say, you know, to thank her for her support, because I think that, you know, that really demonstrates how her role is working moving forward, with Amanda not feeling listened to previously, but now with Donna in post, that opportunity to have somebody listen and understand and work with you is helpful. Thank you. So we're going to move on now to agenda item 2.2, which is the Governor and Membership Delivery Plans. And we're with Sam for that. So Sam, if you could introduce yourself before you start.
Thanks, Sharon. Hello, everybody. I'm Samantha Swindell. I'm the Governor and Membership Officer, the substantive one, back from maternity leave. So I'm now in post again, and I'm just going to take you through the Governor and Membership work plan, delivery plans that come off the strategy. So the committee is, the purpose of the committee for this particular item is for me to advise them on what that plan is, and also their actions that is required is to consider and progress and decide whether the actions is required. So I will just take you through. It's a pretty long document, and I have got an update progress that is still in white on the 17th of July for each of the actual delivery plan items. So without going through it too much, if I've got any questions on those, I've updated all of them in turn, and I'm happy to take any questions that any of the committee's got, if that's okay.
Thank you, Sam. Just trying to get the questions. So, Carol, Carol has put in the, oh, I'm having lots of chats come through. Carol has put in the chat bar, is there a draft? Oh, she hasn't seen the draft plan. So I think we need to get a draft plan to Carol.
It was just specifically, sorry, on strategic priority number 7D, to develop a governor's communication plan. It was just that tiny bit, which is quite important. As a public governor, I just wondered, is there a draft copy of that to look at? I'd be interested in what that says as a public governor.
to improve the profile of, so just to go over that then, so it's 7D, and it's to improve the profile of governors for greater visibility within and outside the trust and to better represent the interests of the members of the community. Yes, I mean, it's an ongoing thing, and we always have lots of opportunities where we're doing that. And a good one is that we're actually sitting on the engagement forum now, I am, for the Integrated Care Board. So, and system. So we're actually got some really good wider opportunities coming into that forum that this plan could feed back on, Carol. Visibility outside and within the trust, that kind of falls into what Sharon was saying about the opportunities as well that we're going to pick up on, and that we can make better use of skills, I think. If that's what Sharon feels as well, was that it kind of does feed into that, doesn't it, Sharon?
Yes.
So yeah, there are lots of opportunities there. It's just making sure that they're coming in and they're getting fed back out on the Governor's Weekly. Carol, does that answer your question, or do you want to ask me anything else in relation to that?
I think Joe's got some information for us, Carol, so I'm going to move over to Joe.
Hi, yeah, Joe Walker, Head of Communications. So, Carol, we've been, my colleague in my team have been working quite closely with Shanna, and obviously we'll take that up with Sam now she's back. So to pull together a bit of an ongoing content planner but we haven't got that finalised just yet. So we were waiting for Sam to come back to kind of get that down on paper. But we should have a bit of a drip feed of bits and pieces throughout the year in terms of communications that'll be advertising kind of what governors are doing, where the other publications that will kind of be promoting what you do, and other forums and posters and bits and pieces that we'll be doing. So once we've got that down on paper, we'll be happy to share that around the representation committee, but that should be in the next month or so, I'm hoping.
Okay, that's great. Thank you.
Okay, thanks, Joe. Has that answered your question, Carol? Yeah. Okay. I just wanted to ask something, Sam, and it's about it's 1D on the log, which is amber at the minute, and it's engagement with less represented groups, such as BAME, learning disabilities, etc. I just looked at the timelines on that and thought that had actually taken quite a time. I know there's a gap between our representation committees, but I wondered if you could probably follow that up as an action and tighten it up, because it's a discussion around equalities we've been having in the people committee, and I think that that action could do with a bit of greater emphasis on it to try and get a clearer picture within a shorter time period of how we're going to take that forward. Is that all right, yeah. Sam? So just a bit of challenge around that.
Yeah, absolutely. Thank you. Yeah, definitely. We'll pick that up and prioritise. Yeah.
Great. That's lovely. Thank you. I don't see any more questions for you. So if anybody's got any, they need to shout up quickly. Otherwise, we're going to be moving on. I think it's still you, Sam, isn't it? With the governor engagement.
Yes, it is me on the governor engagement. So the governor engagement paper, which we have written, was off the back of the Council of Governors. Actually, it was an action that came out of that in terms of governors engagement. We felt that we needed to have a bit more insight into governors' meeting attendance, and we've done a governor engagement survey as well. So the paper itself sets out the results of that, and it's all there on the paper in terms of what we found, basically. So I don't know whether there's any questions to take from that paper, but it is for discussion from the governors around it.
Right, Bex has a question for you, Sam.
Not really a question, it's more of a comment actually, because a lot of the people that have been sort of noted down as not attending wouldn't be attending, and so are they reading the papers for the meetings, and is something going forward being done about that? Because at the end of the day, if you're not reading the papers and you're not attending the meetings, then the message isn't getting through to those people that aren't?
Yeah, that's a really good point, Bex. And yes, it has been a challenge for us in the past. There has been a slight improvement on the actual do not attend people that are getting back to us, so that's lowered considerably, but we do lend that to a ring round in the lead up to the meeting, which has improved that statistic. And in terms of the apologies, obviously that's they're given to us as well. But yeah, in terms of reading the papers as well, that's always going to be a challenge. And it's one of the things that we're actually trying to prioritise in the paper, or we hope it comes across in that way. We're actually trying to prioritise the main meetings for the governors, because one of the things that we're picking up on in the survey that came back to us was that we're actually providing too much information, and it's a little bit of an overload, particularly on the Governor's Weekly. So we was trying to focus on the main meetings and the attendance for those, and making sure that when governors actually attend the meetings, they understand the meeting mechanics, and also they understand, you know, what's written in the papers and that they've read their papers. So I think that's going to have to be a big focus going forward, and I do invite my colleagues Karen, Scott and Gemma to actually come in on that if they want to say anything about that. But that's one of the main things that is actually coming out of the paper.
Yeah, Karen would like to come in on that, Sam.
Okay.
Thanks, Sharon. Hello, sorry, I didn't introduce myself previously. I'm Karen Scott, Head of Corporate Governance. So Sam's right, and well, in response, trying to respond to your comment, Bex, it is a very specific issue, and there's been previous discussions, and it's been mooted in previous meetings about lack of attendance at meetings, and we committed to do everything we could as an organisation to support governors, as we I hope previously have, in attending as many meetings as possible and highlighting those that are really the most important to attend. I think that this questionnaire sort of touches on quite a broad range of subjects. And I think really the nub of it comes down to actually governors engaging in reading about the meetings in the first place, attending them, and then being able to contribute and actually fulfil their responsibilities as governors. Yes, they've got far more to offer, and some governors have got more time. Some have got, you know, full-time jobs. Some have more time on their hands and can commit to doing more. And we do talk when governors are first elected or appointed about the main areas of responsibility, and specifically focusing on the full council meetings as being those that they have to attend. But there are an awful lot of other meetings that are really informative and really helpful, this being one of them. Also joint board meetings that are held in private and less formal, where some really important discussions take place about things such as service changes, and we consult governors about the future within the organisation, about trust strategy, all sorts of things. And it's really important that we get as many governors attending those meetings as we possibly can. I think I really have got concerns about whether governors are even reading some of their emails that are being sent out. They're even seeing the information that we're actually sending to them. And I think at some point or another, in answer, sorry, a long way round in getting to your comment, Bex, we are going to have to look at in more detail about individual commitment to the role and engagement in the role, because, you know, there may be people that want to bring what they've got to the role and don't have the opportunity to, but others are just not attending meetings. So I think it sounds quite harsh, but I think at some point when we've looked and exhausted all the opportunities available to us in supporting governors to carry out their role as effectively as possible. And that includes attending meetings by bringing people round and asking them if they're going to come. We may just have to start looking at whether they're meeting the responsibilities of the governor role. I'm sorry, that is a bit waffly, Sharon, but I think it's really important, and it's a hard message, but I do think we have to take it very seriously. It is a commitment being a governor.
Yeah, thank you, Karen. So just on that point, before I move on to Lucy, is there any value at this stage of writing to those governors who are not attending the majority of things to ask whether there's anything else that could help facilitate their engagement? That would seem like a final step before looking at whether actually there's a commitment to the role of governor.
I think it's a really valid point and suggestion, Sharon. It has been done previously on a global basis, so writing to everyone, but I think we do need to do that, and I think we do need to give the opportunity for governors to explain to us if they've got personal reasons or commitments that mean that they can't. This is not about us not wanting to understand and support. But if people are not prepared to share with us and explain to us, we can't do that. So I think it's a very good suggestion, and we may well get to that point, Sharon.
Right, okay. So we've got Lucy next, and Emma and Amanda in the queue for you.
Thank you. I was wondering if it might be helpful for me to support yourselves, Sam, etc., on some of the things that I've done within my role in managing a huge team of volunteers at the university. Because, of course, inevitably we experience the same sort of examples. People come with good intentions, but life changes, or actually it becomes less of a priority to them. But how do you manage those people? The first thing I'd say is that the induction process has to be watertight, and that is absolutely from my experience. You have to have something that's very crystallised right from the outset. That is an induction document. It's a handbook that's made very clear. It covers all that stuff that's really important around code of conduct, etc., glossary of terms, what we expect, ways we might want you to be involved. But I think within that too, we can set out almost a one-pager, because I know that I have struggled with this at LPFT, a one-pager of what are those meetings that we are talking about, because they're quite meaningless to me at half of the time. But I think you need to be really clear, a bit like when you're applying for a job, when you're saying skills, what is desirable, what is essential. And we're making very clear those meetings that are essential that you're attending and the why it's essential that you attend. And again, those other meetings that are desirable and why it would be helpful for you to attend, but not ultimately necessary when we're trying to prioritise. It might be helpful to have documents that support each individual. I know that I have them, and we call them ongoing achievement records. It's probably a little bit too much, but it's a way that we can document a person's journey with the trust, on maybe some of the skills that they're undertaking with the trust, so we can capture their own personal development. Because, of course, ultimately this stuff helps us in terms of character building, CV building, and it creates that real sort of portfolio of what that person's doing with the trust. But I think that what it's ultimately starting to do as well is create that evidence pool of where somebody is perhaps not doing exactly what they want. Now, something that I do is twice per year, I go back to the GDPR thing and I use it as my little weapon of choice, where I email everybody and I say, really, it would be wrongful of me to be holding your data if you no longer wish to be involved. It gives somebody that opportunity without making it sound like we're telling you off, to maybe have a little think. Do you still want us to hold your information? Is this still right for you? And it gives them that soft opportunity to walk away from something. And I generally do find that works. Before we go down those more formal routes where perhaps, and I don't know if this already happened, Sam, but do you have one-to-ones with each governor per year, where we can then reflect back on what they've done over the year, but it's more of that evidence-based reflection?
There's nothing formal that is being done at the moment. Informally, we'll always check in with governors and make sure that they're okay, they're on track, and if we're supporting enough. But in answer to your question, we don't have anything formal like supervision type thing. Is what I'm hearing from you, Lucy. I think that's what you're sort of saying, having that sort of running sort of record on governors and knowing where they're at when they're at.
Yeah,
That's
absolutely.
it, yeah.
And I do appreciate that that might sound quite hard. I recognise this is volunteering, and I would always be very cautious. It might be something that the governors want to work on together to create those documents. What does this record look like for you guys? How would you like to see it framed out? You know, we can have those awkward conversations together. You know, we're all adults. Hopefully we can have that conversation about how we can sort of crystallise some of this thinking. Perhaps it's not for the trust. I'm just trying to present something to think about.
Lucy, I think you've come up with some incredibly helpful suggestions there. So can we get that down as an action for Sam and yourself to liaise, and we'll take some of those suggestions
and
forward.
Again, I didn't introduce myself either, so I'm hoping that everybody realises that I am now the new deputy lead governor. But yeah, I mean, I've done this work. It took me a long time to get it right, and it's certainly something that's transferable to the trust if you wish to just borrow and pinch and take what you need. Absolutely.
That's great, thank you. That's lovely.
Yeah, thank you.
So we have Emma, who's got a question.
Hi everyone. I'm Emma Slack, Public Governor for East Lindsey. Morning. In relation to, it might be a question or a comment, I'm not entirely sure. I was thinking, could you like do maybe wellness checks on governors? Through a personal experience myself, I have had a lot going on since I've been a governor. It has intensified this year as well, but I won't go into that, obviously. But I think, say, maybe, I don't know, what, not monthly, that will take too much time maybe, but like a quarterly wellness check on all governors as to whether how they are, you know, is their mental health okay, or are they struggling with financially, or, you know, there's all sorts of things that can happen that can impact someone on whether or not they can manage their role effectively. And I think if they got somebody that they could just talk to and maybe iron out a few wrinkles that actually in the end it may be not as bad, and then they feel that they can continue. Do you know what I mean? Rather than feeling like they're in a corner and they can't do anything about it, if you get my point. Whereas if it's like a proper wellness check on checking how they are, and then, you know, because at the end of the day we're all about mental health and everything anyway, aren't we? So, you know, perhaps we ought to promote that within the governors and everything else as well, and check that everyone is all right.
Yeah, I mean, if I can come in, Sharon, if that's okay. Yeah. We have historically always made sure that we check that governors are okay at that very first initial introductory level. I suppose what we've got to be careful about is that we don't cross over into the clinical side, but we have got support for that within our wellbeing service. So yes, of course we can have those initial conversations, and that's really just, you know, sort of being human. It's part of, you know, it's part of what the officer likes to engage with the governors, to make sure that, because ultimately, and this may sound quite, you know, sort of strong, but ultimately, if the governor is not well, they will not function within their role. They will not attend the meetings, which actually comes back to the paper that we're actually talking about, you know. So it is a really important part, but I think equally important is where those boundaries lie within those conversations, if I may, and just having those having a bit more of a process for it. So I'm glad you've raised it, Emma, with us, because of its importance in the attendance side of things, and keeping the governors well. And of course we do have a majority service user carer council. So and that's not to say that other governors might struggle as well, not necessarily in that category. So yeah.
It's just a thought really, because I thought, you know, like a wellness check thing or whatever, it could be helpful to quite a lot of people. I mean, maybe then it might come up that they've got they feel nervous about something about a meeting, or they might, you know what I mean, it might bring up something that they might have felt that they couldn't say.
Yeah.
You know, something that they're nervous about, or they're scared of putting the camera on and talking, or, you know, it could bring up anything really.
Yeah, absolutely.
Yeah, thank you. I mean, that's really helpful. And I think Bex has also raised that the meetings that governors have, they call the by the cooler meetings, also have to support the governors in self-help and, you know, the wider kind of understanding of family and you know, the environments we're living in. So that's helpful. I'm going to move on to Amanda.
Thank you, Sharon. Hi again, it's Amanda. Thank you for that reminder as well, Bex. I couldn't actually attend the cooler sessions, and if I'm honest, I totally forgot about them, so it's good to have a reminder to relook at that. But really, just from my point of view, sharing with sometimes where I get stuck, and I spoke to Samantha about this on Friday, is the lack of clarity around that declaration of interest. I wasn't sure what I could and couldn't do within my role because of my, like, the business that I have myself, and also being part of a CIC. So I think sometimes for people actually having clarity on that, it will definitely help me fulfill my role as a governor better, I think, and be more beneficial for the people that I'll represent. So maybe that's something that could be looked at as well, just to give more clarity.
Okay, thank you. I think, you know, it can be a confusing area, so it's always something that governors can raise with Karen or Jenna, and we're moving on to Karen now.
Thank you, Sharon. Just a couple of comments. First, if I could just address the points that have been made about not fully understanding some of the meetings or about what's expected of governors. So I appreciate that not everybody is always able to attend with the majority, the induction that we carry out at every year when we have a main election for governors. But we do at those sessions, we do go through all of the meetings that governors have access to and which are more of a priority than not. Perhaps we need to just revisit that induction session and just look about how much detail is being provided, and where new governors are not able to attend that session, make sure that that's followed up with them, and we can always carry out one-to-one inductions to ensure that everybody gets that information. But I hear what people are saying about having a reference sheet, if you like, a quick crib sheet that they can look at just to remind themselves during the year on an ongoing process. And the other thing that I just wanted to say was, in terms of the comments that are being made about checking in with governors and about what people can bring, etc. It's a real shame that Debbie Abrams, our lead governor, is not able to attend today, but I think it's really important that Sam and I have a conversation now with Debbie, because I think there's a really key role for the lead governor in this, and I know that Debbie is really keen to progress it, as well as ensure that we increase engagement from governors. So I will take away an action to follow this up with Debbie and see where those conversations take us. Thank you.
Thanks, Karen. Can I just check, Bex, is that a comment that you want to say out loud around the new governor 12 months on?
Yeah, it is, because being a governor, it takes a little while to sort of get into the swing of things, to know how things work. And I know that from coming into it in the middle of COVID. But what I was going to just say is that there is a development day after the elections, and even if you've not been able to make the development the previous year, or you have and you didn't take it all fully on board because it's a lot of information, what I was going to say is that you can still sort of do the development part of it again with the new governors, and you know, twice is better than none at all, and just to make life a little bit easier for folk.
Thank you, Bex. That's great. We're now moving on to item 3.1 on the agenda, which is involvement activity, and Linda is going to take us through that. So if you could introduce yourself, Linda.
Sorry, Sharon, it's not Linda. Linda's on annual. That's fine.
Oh,
It's
is
not your
she?
fault. The agenda wasn't changed. Linda's on holiday today. So my name's Sarah Cox, and I'm the participation coordinator for the trust. So thank you for inviting me on this morning. And I'm just going to go through. You've obviously had our paper, but I'm just going to go through some highlights from the engagement team from the last quarter. So the first highlight was our eradication of dormitories programme. So we have a patient carer group called the Building Together Focus Group that has been a pivotal part of this project right from the start of the build. And I'm delighted to say we won an international award for service user engagement at the Design in Mental Health Awards, recognising the co-production work that has taken place throughout this project. And the Building Together Focus Group has also been shortlisted for the Service User Engagement and Experience category in the LPFT Values Awards in October. So that's brilliant news. We had the formal opening of Castle and Ellis wards, which was a huge success. And 5 of our experts by experience from the Building Together Focus Group were asked to attend and help with the opening of the ward. And then this was followed by 4 of our experts by experiences being invited to the official opening lunch with Claire Murdoch, who is the NHS England Director of Mental Health. We've recently followed up both visits to Castle and Ellis wards to engage with patients and staff about their experiences and expectations of the new wards. So we visited them last week. And Building Together Focus Group now continues to support the eradication of dormitory project on the commencement of the new adult acute mental health inpatient ward at Norton Lee in Boston. So yes, a big piece of work there, but really, really worthwhile. Recovery conference, just to let you know, unfortunately, due to the juniors doctors strike last week, we took the decision to postpone recovery conference. We're hoping that this is going to be in November now, so we will keep you informed when we've got the date, but it will be still at the old barn in Grantham. The children and young people avoidant restrictive food intake disorder, just to let you know, there will be further planned engagement for this work to support this ongoing pathway. So look out for that. Staff recruitment workshop. We held another training day on the 24th of May and supported 10 patients and carers who would like to be involved in our interviews and staff recruitment moving forward, so that's good. And then we'll hold another workshop in September. Older People and Frailty Division. So this is a massive piece of work and we've put together an engagement programme to support the temporary closure of Manthorpe ward in Grantham and to enhance our dementia home treatment team expansion. So we've put together a 12-month rolling engagement programme, which includes us visiting targeted older adult and dementia community groups, public events, more cuppa and conversation events, and we're also going to be visiting local libraries throughout the county. We're at the shopping centre in Grantham, Grantham Hospital, and lots of other events, so look out for those. We've also organised our service leads to visit specific groups, including men's sheds, dementia cafes, Carers First and Age UK. So this moves us on to trust strategy. So the participation team have recently supported Chris Higgins with his work to develop the trust strategy. And this has included 6 community visits, a focus group and staff engagement. We have recently recruited to a comms and engagement post to work with our Ops Courage team, which is part of the veterans team. And then finally, for us, on the back of listening to Amanda's story and just hearing from other governors. I just want to let any governor know that if they want to be part of our involvement contact list, to please let Sam know, and she can pass your details on to us, because we have lots of opportunities for you to get involved, because we have lots of engagement that's going on, not only within the trust but as part of the system. So there may be something else that you'd be interested in, and we regularly send out lots of different ways that people can get involved, as I say, not just with our trust, other trusts, other third-party community groups. So if that's something that would interest the governors, we would love to hold your details on our database. I know that there are some governors already on there, and I know some governors do come and support us at our engagement events, and it's always great to see you there. So yeah, absolutely, if you want to be more involved with us, then please let us know. So thank you very much. I keep hearing pings everywhere, Sharon. So
thank you, Sarah. You have actually got a few, so we'll start with Bex.
Yeah, it was just a case of, I believe you've got an engagement event in Grantham this afternoon for the dementia home treatment team. Forewarned, there's been a lot of chatter about it in both a positive and a negative way on Facebook. So,
yeah, no, thanks for that, Bex.
Wishing you all the best.
Yes, thank you. We have a councillor from Grantham joining us this afternoon, but this is, I'd rather have people there. I'd rather people come and find out a bit more about it rather than the speculation. And, you know, yes, it is a big thing for us, because we do know that Grantham, obviously with things that have happened in the past in Grantham, people do feel in Grantham that they lose a lot of our services, but that's definitely not the case in for older adults. If anything, it will enhance dramatically the support that people in Grantham will get from this hospital at home. So I'll let you know how it goes, but I'm looking forward to it. Thank you, Bex.
Thank you. So we've got a comment from Sam.
Yeah, thanks, Sarah. It was just regarding your invite to the involvement list for the governors. Thank you for that. Just to mention that as well, the governors as members will receive engagement events through the membership database, and which is quite good, because you'll see it as coming in as a member rather than a governor. And I just thought it might be worth clarifying, Sarah, if you wouldn't mind, that actually if governors go on your list, they get a little bit more information than that, don't they? So it's whether or not they want to.
Yeah,
is that
absolutely.
Okay?
Yeah, absolutely. Yes. So anything that is within an engagement event that LPFT and that we are organising, I would automatically send Sam to send out to all governors and members. But there's some third party information that we get as well from other groups, organisations, trusts, that we send to our database. So it's whether the governors would like a more varied range of activities in Lincolnshire, or if they're happy just to receive the engagement that LPFT are doing, then they would, yes, get that by being a governor or a member.
Thanks, Sarah.
Okay, thank you. And Jackie has a comment for you.
Yeah, hi Sarah.
Hi, Jackie.
So I'm, as I said, staff governor in older adults, and so I'm working with Sarah, as she very well knows, on all the engagement events regarding the dementia home treatment team. And in conversation with Sam recently, I have raised an ILOG, and I apologise in advance if I don't understand the practicalities. But I did mention to Sam about how we almost, I don't know about if the amalgamate is the right word, but almost amalgamate the contact lists, because it's like we've got the membership list and then we've got the involvement list, and whether there's a way of bringing those two together so that we expand the engagement with our members. So I have raised that as an ILOG, and so Sarah, you'll probably be hearing about that, because I'm aware that the membership team and the involvement team already work very closely together, but it's just about how we maximise the opportunities for governors via the involvement team, because you do so much. There's some fantastic opportunities there for governors that perhaps they're not always aware of.
Yeah, I would hope they are aware of everything, Jackie, because as I say, every time we do something, I automatically send it to Sam for the governors. I totally understand though that if you're on more than one, you know, you're getting in, you know, there is a lot of
you get it double.
You'll get it double, sometimes treble. If you're a member, a governor and on our list, you know, you're receiving the same thing 3 times. So I definitely think there is something that Sam and I can work on to look into what lists you're on and making sure that you're only getting it once and what you are getting is meaningful for your role and what you're looking for.
Yeah, lovely, thank you.
Okay, thank you, Jackie.
Thank you. We've got Joe who'd like to come in, and then Sam.
Hi, yeah, Joe Walker, Head of Communications. Just to add to sort of Sarah's point a little bit, it's a really good point, Jackie, in terms of amalgamating the list. There is some complications in terms of some of the GDPR legislation about what information you can send to certain groups depending on what they've signed up to. So whilst all of Sarah's materials in terms of the LPFT specific engagement events do go to the wider membership because it's very much LPFT specific, what Sarah's list, as she's sort of alluded to, is also sending out is those third party ones, which is what we can't send out to members because they've not signed up to third party information. So that's some of the complications in terms of some of the legislation. We'd maybe just need to unpick what we could send them to amalgamate the lists.
Thank you, Joe.
And Sam has a question or comment.
Yeah, it was just in relation to these discussions really, that, and back to the iLog. I mean, we could have discussed it in the iLog section, but we'll talk about it now. The iLog that has come in, the other part about it as well was in terms of getting more members, you know, in terms of getting tighter on the processes between getting members at the engagement events and things like that, so that membership isn't really sort of like a forgotten, and it actually, we actually get more engagement as well. So we're working quite closely as it is, but I think we could probably have more of a discussion about, you know, how at the events we can, whether it is me do a little bit of a presentation or a governor comes along, does a little bit of a presentation, or we've you know, have more stands at events. And I know that the engagement events, you know, are dependent upon engagement for that, you know, and how many attend. So yeah, there's lots of conversations that we could have around it.
Yeah, absolutely, Sam. I think some of our engagement events like this afternoon's, you know, it will be a very small group, and majority of the people that are coming are stakeholders. So but there's no reason why I can't take leaf. I'm not, you know, they're not the type of events where you'd have a stand to talk about members, but there's no reason why we can't take some flyers or some information with us to have on the table, and we can definitely, as we welcome people, and you know, can say please feel free to pick up an information if you would like to be a member. But definitely I think conferences is your way forward with membership's concerned, Sam, because I think there's lots of opportunities, not only with NHS, but Health Watch have got lots of events going on that you could join. ICB engagement colleagues, sorry, Integrated Care Board engagement colleagues have got some summer road shows coming up that I think would be ideal for you to go to. So yeah, I think there's lots of opportunities where you can go and to different conferences and events. Yeah, and we're the same. We want more patients and carers to come forward and be involved with us and have a voice, and it's about going out and finding those people and explaining what it would be like to be involved within the trust.
Yeah, absolutely. And ultimately, Sarah, as well, the more that we recruit, the more that your information goes out to a wider group as well.
Absolutely.
So it ties in really well.
Yeah, definitely. Thank you.
Thank you, Sam. So I think that is the last question for you, Sarah.
Thank you.
I thought your paper was really good today. It was really comprehensive, certainly more comprehensive than I've seen previously. So it was a really good report. I went to, I had the pleasure of going to the Claire Murdoch event at the New Ward. Yeah, and the experts by experience were there. And after the tour of the ward, they were very keen to sit down with Claire, and they had a long discussion with her, and it was really great to see are experts by experience, you know, patients, carers, influencing directly that national agenda.
Yeah,
So
definitely.
I was very proud of our organisation on that day.
I was
And our
so
patients and
upset
carers.
because unfortunately both the official opening and Claire's visit fell when I was on holiday. I said I've been involved with the group for 2.5 years, and it's just one of those things, isn't it?
Well,
but I had
think
some amazing feedback
Yeah.
from people saying how important it is that they were included, and they are included, and it's not tokenistic at all. They have
no,
absolutely, you know, their comments, because they are our experts. They're the ones that have been on our wards, and this has really helped their recovery as well. So it's a way that, you know, it's a two-way, and that's what real co-production is about. It's about us supporting them and for them to support us. So yeah, we're very proud.
Quite impressive. Thank you.
Thank you very much.
So I'm going to move on the agenda now, and I think Sam's just going to take us through 4.1, which is the forward plan of development and future meetings.
Hello again. Yes, so it's the forward plan of developments, and it's the governor's asked to just receive the report. It's literally everything from today onwards, up until November that we've got on here so far. Sorry, January next year. The only thing that doesn't appear on here is some workshops with the NHS Providers Training Company, which I'm currently getting the information for. So hopefully that will appear on the Council of Governors activities. I'll pop the information on there, but I'll communicate in the meantime on the Governors Weekly about it. So yeah, we've got a lot of things on in terms of the Governors developments, and all of the key is at the top in terms of which types of engagement it is as well. So I'm happy to take any questions about the report, but if you could receive it, that would be appreciated.
Thank you, Sam. So we just need to indicate that we're happy to receive the report. So just put a yes in the chat bar. I've not seen any comments yet. I think that's pretty straightforward, Sam.
Okay, thank you.
Okay. You're getting yeses, by the way, in the chat bar. So we now move on to the Lincolnshire-wide autism strategy, and we should have Emma here ready. Hi, Emma. So if you could just say who you are before you take us through this agenda item.
Hi, yes, so I'm Emma Dominy-Hill, and I am currently part-time the Lincolnshire Autism Programme Lead, although that role comes to an end at the end of August, and then I'll just be back in my substantive role as the Head of Learning Disability and Autism for LPFT. So I'm grateful that you've got some time for me today to go through the Lincolnshire Autism Strategy. So I've got a brief PowerPoint. Am I okay to try and take control and share it if the magic of technology works? Is that all right?
It is from my point of view. I think if you can do it from your end.
Yeah, I'll do my best.
Yeah.
I'll just see if it'll. I'm just waiting for approval. I think somebody will be hopefully approving me.
Okay.
It looks like something's happening there. So let me just see whether this will work.
There, we can see it now, Emma.
Excellent, wonderful. That's a good start, isn't it, when the technology works for us? That's always a bonus. So let me see if I can get it to work forward. So what I'm going to talk through today, I'll just go back, I was just checking it was working. What I'm going to talk through today is the culmination of quite a big piece of work over the last 8 to 9 months, really, developing the Lincolnshire autism strategy. So just to be really clear, this isn't an LPFT strategy as such. This is a Lincolnshire system-wide strategy. So it's been a really big co-production piece of work with a specific work stream, and a huge thank you to Callum Brazout, who is my expert by lived experience and co-facilitator of developing this. So you'll when you read through the strategy, Callum has done a piece at the beginning really of his experiences being part of this. So we're just going to talk through really where we're at from an autism perspective in Lincolnshire and allude to some of the bits that are within the strategy and why we've come up with those suggestions as a way of moving forward really. So there's a whole busy slide there which I think you'll get access to afterwards if you want to look at it in more detail. We always start with this because people's experience of understanding what autism is, understanding autistic people is really varied. Some people have got lots of experience, lived experience, family care experience, and others have never or heard very little about autism. So when we've been talking about the strategy, and we have presented it at the public meeting for the Integrated Care Board and also the Integrated Care Partnership after the Health and Wellbeing Joint Delivery groups in public forum. So I've always started with this slide really, like I say, just to give some information so you can have a brief glance through that. But the main bits I'm going to just pull out today and why we've wanted real buy-in from senior leadership within the system is two main reasons. One is around the cost to society. So social exclusion, you'll see a little, I don't know if you can see my little arrow, but there's one there, that there's been lots of sums done around the cost of excluding autistic people, their families and carers, and we are now saying it's around £32 billion a year, which works out, if you combine cancer, stroke, and I think it was heart disease as well, you combine them together, you still don't quite get to the total of what we would see for autistic people being excluded in its widest possible sense. And the other thing from a mental health trust perspective is these two slides here. So we know that up to 70% of autistic people would also have an additional mental health need. That isn't, by the way, just because they're autistic. It's more often around the fact that their needs potentially haven't been met, or experiences they've had in life which have led to those additional mental health needs. And the fact we've got these really startling figures coming out now, which is the one just below, that actually if you're autistic, you are 9 times more likely to die by suicide, and for autistic women it's 13 times more likely. So actually from a mental health trust perspective, this is something we really need to be considering, and autism and learning disability are in our title within LPFT. So I think as the head of LDA, I always try and point that out. We're not just a mental health trust, alongside dementia. So yeah, you can explore that. Happy to take questions or comments afterwards. So where have we been as a system in Lincolnshire? So we've had historically had quite limited diagnostic services across the lifespan. So at one point 2-3 years ago, we didn't have any adult diagnostic services. We do now, which I'll come to in a little bit. But also we've got some, you have to excuse me today, I've been coughing all weekend. So if I start coughing, I do apologise. I'm trying to keep it going. We've also been developing our children, young people services for diagnosis, and I'll mention that in a little bit as well. Lots of the feedback we've had is around limited support around school and home and that wider community, and we also very much understand that autistic people have experienced significant health inequalities. Very little understanding at times of autistic needs and what we need to think about, and that's come through both difficulties in accessing healthcare services, but also starting to come through within our leader, which is learning from the lives and deaths of people with a learning disability and autistic people. So any death that occurs nationally actually, but obviously in Lincolnshire, we try to understand whether that was something that could and should have been prevented, or whether actually if it's an end of life, was it done in the best way for that person? Did they have a good quality end of life experience? We've also heard, and I think it's been really important, is around the autistic community itself feeling very disempowered. So when we started this process about 8-9 months ago, the autistic community were very angry. That's what came out very strongly. They felt they hadn't been listened to in the past. Things have been done about them, not with them, whereas that's the opposite of what we're really wanting, and that they have been promised an awful lot in the past that hadn't been delivered on. So I think that's really natural, and they had every right to be angry. Actually, the feedback we are now getting coming through is that they are feeling that they are much more part of kind of services that are being developed, things that we're thinking through, the fact that this strategy has been fully co-produced and co-delivered said, I think is kind of evidence of where we're heading for, really. Inappropriate mental health stay. So Lincolnshire historically had been very low performing in terms of the number of admissions of autistic people and people with a learning disability. We had high numbers and people were staying in longer. That is a national picture too, but Lincolnshire, we're trying very hard to move forward really and improve the situation here for our citizens. And the other big part you'll see on the slide previous when you get them is there was quite a lot of limited understanding about supporting autistic people in employment in its widest sense. So we knew that quite small numbers, between 17 and 24% of autistic people are in employment, which actually, given the skill set of the people that we work with, we know that could be far higher if people are supported in the right way. So where are we now? Where have we been working on, really? There's been a number of work streams that have been happening through the Lincolnshire Autistic Partnership Board, but the biggest focus up till now has been about improving the sort of reasonable adjustments and how we support people from reaching crisis situations, which is a bit of a shift because historically a lot of it had been about only working with people once they reach crisis point and when things were going really badly for them, rather than getting in there at that earlier stage. So we've been really focusing on that all-age approach, thinking about the gaps in service provision, the gaps in the community at different points, thinking about how we look at that early identification and support. And a real big focus has been about that re-engagement of the community itself around co-design, so that making sure we are designing things that autistic people, their families and their carers feel is the right thing for them. Huge focus on reasonable adjustment. So a lot of what's come through is that autistic people don't always want something very specific and bespoke, but actually what they absolutely do want is the same rights and the same access to services, to community assets that everybody else has, and that they're not there at the moment. So thinking about how we can support people across the county in all different areas to ensure that they are reasonably adjusting for autistic people. We very much know that there's a statement out there: autism plus environment equals outcome. So actually, being autistic with the right environment will equal a much better outcome for people, and that's kind of what we're wanting people to understand. And a real focus on those proactive rather than just reactive strategies. So you can see at the top the three big focuses for us. One has been about reducing inpatient admissions. And that's been because of that situation we were in a few years ago with, compared to many other systems, very high numbers of admissions. I will be a little controversial here. I will say I think Lincolnshire is very open and honest about our admissions. We include everybody that goes into our acute inpatient services. Most people that are autistic that go in are not going into hospital. They should never really be going into hospital because they're autistic. They're going in because they have a mental illness or sometimes around mental distress. And I think some areas have not always been open about their acute admissions. We do that in Lincolnshire. So I'll just put that caveat in there. Thinking about improving support for education. So there's a whole piece of work being done by Lincolnshire County Council, the Working Together team, which has been recommissioned, thinking about how we support education providers to make those reasonable adjustments and ensure that our children, young people are supported in education settings. And the other big piece of work has been around improving access to diagnostic services. So I mentioned historically we didn't have that adult diagnostic service, and we now do. And also there was some work done around CYP to make it more NICE compliant in terms of the diagnostic process. We're not there yet, but we are better than we were. So where are we going? As I say, we've had a number of work streams, three big ones. One has been in relation to co-producing this strategy, which is now completed as of the end of last week. The other two big pieces of work we're doing, I'll pick them sort of separately. One is the middle one here around utilising community assets to provide a step on and step off lifelong support. So we have had a co-production group, which has been quite a big co-production group actually, devising what is going to be our virtual autism hub. So it is had a model designed for Lincolnshire. We're going with a virtual model because there was lots of discussion around how other systems have gone with physical hubs, which is fine where you are in a county where you've got one big city that sits in the middle and it's very small villages around the outside. Lincolnshire is obviously, we know, isn't like that, very rural. So the virtual model has been felt by the community itself to be better able to meet the needs of autistic people, their families and carers. So when I say virtual, I think people think that means online. We're thinking more mobile. So if you think mobile autism hub, so it can kind of pop up in different places around the county. So we're currently in the operationalisation stage of that, just in terms of recruitment into management posts, project lead posts, and then we'll be following on. We've got 3 autistic lead posts within that to represent parents, carers, autistic children, young people and autistic adults, and we've got our autism specialist navigators that will be part of that hub as well. So there will be a central place, so both virtually online, websites, phone numbers and mobile places for a trusted source of information, support in terms of where to go next or how to access help. And the other big thing about the Virtual Autism Hub is they will be able to support current community assets out there in the voluntary community third social enterprise sector around setting up where there isn't something already, but also those that exist that need support to become resilient and to stay functioning well. There is the support to do that and there's funding attached to that, so it will be a funding source for community groups as well as practical source of expertise. So that's that one. The other one that's been very busy space is the one on this side, which is the all age accessible, nice, compliant neurodevelopmental pathway. It's a very big mouthful, but basically in relation to the autism strategy specifically, this has been a review of our children, young people's diagnostic pathway, which we understand and we hear lots of concerns from parents and carers and sometimes young people, but predominantly parents and carers about how inaccessible it sometimes feels, that it doesn't necessarily meet the right needs and all sorts of other bits and pieces. So again, big co-production group, which that one currently is still running. We aim to have the new pathway designed by the end of August, so we should be having some workshop groups for the children and people themselves over the summer. Obviously it's easier when it's outside of school time, but we've got parent carer experts as part of that group who have been very instrumental in thinking about the design of what we're looking at. So that's the piece of work that's continuing at the moment. And as you can see, so that's what we've been working on. All of this is to lead to the bit for me to know that I've done my job is people tell me their experiences are better than they were before. That's ultimately the aim of all of this. We can get numbers, we can get data, but the proof of the pudding, as I always say, is if people come to me and say it feels better, it feels different. So for example, what we hear at the moment is people saying it feels better about co-production, it didn't feel genuine before. Then that means we're actually hearing that from the community, that their experiences are actually different, and that's what we're aiming for. So you'll see in this slide, we want an all age approach. The word neurodevelopmental, for anyone that's interested, although we're focusing on autism, or I'm focusing on autism, this is also looking at ADHD, tics, Tourette's, potentially developmental language disorder as well. And we are thinking about a much wider pathway in Lincolnshire for all ages with this. The main reason being, we absolutely know if somebody is diagnosed as autistic, there is a high likelihood there may be a co-occurring condition such as ADHD, language difficulties or other things. And what we absolutely don't want for people is that they go into a pathway, they get one label, and then someone says, but you also might have this label too. So now you go on another pathway and you have to wait another X number of months or even years to receive that label and that support. So we don't want that to happen. What we're looking at is that it's a one-stop shop. You go in if it's felt that that's the right pathway for you, and all of those different elements can be looked at on an individual basis for somebody. That's the aim. That's what we're hoping for. As I mentioned, co-design and co-production is absolutely heart of everything we are doing. So nothing has been done that has not been co-produced. And sometimes that co-production has been right at the start of the co-production ladder. It actually, absolutely has been co-design at the highest level. So I'll be honest, I thought about the Autism Hub being a physical building. We were going to have one, and that's been chucked out the window. We've come up with an entirely different model, purely because it's been, I believe, fully co-produced, all the way down to basic consultation, sending things out. Some people don't want to be there at the design stage, but they do want to have some input to say whether or not they think it's a good idea. So we're trying it at all different levels. A real focus on identifying what's a clinical need and what's a non-clinical need. So many autistic people don't have clinical needs, they don't need to see clinical services. Many people, if they got the right support in the community, that non-clinical support, at the time they needed it, when they wanted it, that step on, step off point, because people's lives are complicated, aren't they? And sometimes we need help, sometimes we don't. That is enough for some people. So the hub will be looking at that non-clinical support. We also need to then think about the clinical support. We know that for autistic adults, we have some post-diagnostic. So once you get your diagnosis, you can get some support. But for children, young people at the moment, we don't have a clinical offer. So that's something we're going to continue to look at. And I've already mentioned about reasonable adjustment. So creative funding sources that are proactive, that's the other thing, is to help look, for my job is to be looking everywhere around the country really at any funding sources we can do to make sure we get the monies into the people that and the services and the groups that need them. So how are we going to get there? So what we need and what we need to sign up for really from the wider system is particularly senior system leaders being committed to the agenda. So you'll have seen in the very first slide, or you may not, but you'll see afterwards, that actually in terms of the numbers of autistic people in Lincolnshire, I think it's much higher than most people anticipate. So currently in England in particular, there's often a rhetoric that 1 to 2% of the entire community will be autistic, but you only have to look in Northern Ireland, Scotland, obviously America, they often get there and they do it in a bigger way than we do. Actually, numbers are looking much higher, sort of 20% potentially, or higher than that, depending on which research you look at. So autistic people are a big part of our community, and we really need leaders to recognise that the impact of not supporting autistic people is, you know, devastating to the family, devastating to the person, but also devastating to our economy. So there's a whole big reason to commit to doing something about this. And if we have system leader sign up, then actually it's much easier to get things shifted and changed and to be quite creative and innovative about how we think about things. We really need to listen to the community. Sometimes that can be very hard because they say they're a community that have been very much not heard, very much disempowered, and they've been very angry. And sometimes it can be hard to listen to angry people, but it's the right thing to do, and it's the only way to make things any better or do it differently. So I think listening and continuing to listen is really, really important. And for me, that creative thinking, as I say, really separating out what's a clinical need and what's a non-clinical need. And I am a clinician by background, so it can be very easy for us to get into that idea of we must fix everything for people, and we've got the skills, we must do it, when actually the reverse is often true. And actually moving that funding into the community sector, they're actually much better at doing some of this stuff, and it doesn't need to be clinicians who are very expensive to do that. So we just really need to get people thinking a bit differently about it, really. So I've mentioned 3 there, I won't go into any more. I shall stop there in that whistle stop tour, because I could talk forever about autism, and happy to take questions or comments.
Thank you, Emma. We've got a question from Amanda.
Hi Emma, thanks for that. It was a really good presentation. The question I have is not probably in clinical, but non-clinical, with the hub that you run. When you do the individual, I don't know if diagnosis is the right word, but you're working with people after they've got their diagnosis. Does that then include how they look after themselves physically and emotionally in education? Do you cover that with them as well? So you look at them as a whole person rather than just from their mental point of view and what's going on in their brain?
So, well, there's 2 things there to what you've said. So one is in relation to the diagnostic process, that's not part of the hub at all, because the hub's a non-clinical offer. But in terms of what you've just described, absolutely, we do need to do that. Do we do that now? Probably not. In adults, yes, we do. I think we're very good at a kind of a robust assessment. For children, young people, no, we don't, because the current pathway, it's quite old-fashioned, let's put it that way around. There's lots of work that needs to be done to bring it up to 21st century and 2023, and that would include things like, you know, in my opinion, we need sensory assessments in there for people. There should be communication assessments, and as you've just described, Amanda, really what a family wants to come out with and what a young person wants to come out with is, okay, so I'm autistic, but what does that mean? What does that mean to me? And actually, what does that mean for me in my future? That's really what they're asking. So the new pathway we're designing should incorporate that, should include that much more robust assessment, holistic assessment of the person, and it won't necessarily lead into the interventions or support specifically, but it will talk about, you know, little Johnny, what Johnny needs, and actually how people can adjust to Johnny, not just because he's autistic, but just in general. So I think that's part of the clinical pathway, and it's part of the diagnostic pathway. Just to mention the hub itself doesn't exist yet. I say it's in operationalisation, so we're just in recruitment to the staff. It should start, you should start to see more about it and hear about it probably from September onwards, because then we should have people physically in post and it'll start to roll out. That will take some time. But the hub, we've been very, very clear about the hub. The hub is not purely for people that have a diagnosis. You can go there whether you're thinking you might be autistic, but you don't want to go through the diagnostic process. So people that self-identify. You can also go if you haven't had a diagnosis, but you're on the assessment pathway for potentially being autistic. So the hub is much more about, if you feel the hub and what it offers can help you, you can go and access it. You can step on, you can step off, and it's not linked to labels or diagnostics. So just two different points, and I don't know if that answered all your question, Amanda, but hopefully give some information about it.
No, that's great, and it's good that it's not all about labels. But just one more question while I'm on
Yeah,
here.
fine.
If it's about the children, then will you give the parents education on things like nutrition, how to look after them physically? And also, I'm only saying from experience, you know, my daughter hasn't got an autistic diagnosis, but one of the psychiatrists did mention that when she was discharged in 2021, but her emotional health wasn't supported at all when she was in units. And emotional health is so important in getting the person to understand that their feelings is their body trying to talk to their mind, which is obviously the mental health. So connecting all that together and helping the parents to actually understand that as well.
Absolutely. So again, for me, there's a split between what clinically should be offered and what's a non-clinical offer. So one of the things we're really keen about with the hub, we've got some brilliant groups out there that already do some of this stuff, but very small scale, just for their very local area. And some are just children, young people, some are just adults. So the idea of the hub is, if there is a need in Lincolnshire that pops up, another example I was given quite recently is autistic pregnant women. There's nothing out there for pregnant women that are autistic. So actually, I think we've got four youngish women, I don't know ages, for pregnant women anyway, who are asking for some support for being pregnant. And actually, the idea of the hub model is that they could go out to a very, very brief tender process of who's got the skill set to do this, who could offer that support. It's here currently in Lincolnshire. Let's roll it out. Let's do it. So, and I say from a community perspective, there's lots of smaller groups out there that do this very well. They just don't have the funding. So, in terms of parent education, for children, young people, PACT, Parents and Carers for Autistic Children Together, they're a brilliant group, but they're Lincolnshire based, and they do a group in Gainsborough. There's two other groups that do something down Spalding Way and sort of south of the county. So it kind of exists. People don't always know about it, and it isn't always rolled out to all ages, because you're potentially talking about from I don't know if you are actually, but from an adult perspective, as a parent, an autistic adult, what support is out there. So if the need is there, then I guess we create the resource to support that need, and that can pop up and it can be wherever it needs to be. That's the aim of the hub. So the hub won't do the delivering itself, but it will find individuals, often with lived experience, actually. So quite often the best, they often know more than the professionals do. So there's something about that, and utilising that skill set in Lincolnshire. That doesn't detract though from clinical support. So we do have within LPFT the Transforming Care Liaison Service. So they're only relatively new. I don't know whether your daughter would have had access to that, but they've only been around for about 2 years now. They support individuals with a diagnosis of autism or learning disability in any hospital, whether it's in county or out of county, about reasonable adjustments, thinking about what should be considered. They will support if it's considered a diagnosis, but those individuals don't always get that full element of the MDT that's available, purely because of funding. We couldn't do it for everybody, but that's the clinical offer we already have in Lincolnshire. So
yeah,
okay.
Thank you. Thanks, Emma. I'm going to move on now to Lucy.
Hi there, thank you so much. I've got a number, well, I've got a little shopping list here to go through,
Go
if
for
I
it.
may. So
Of course you can.
I'll run through it all and then you can decide what you want to answer, if that's okay. The first thing is I want to say, actually, from a very personal level, thank you, because I feel quite heard today in this sort of section of the agenda. I am a parent of the child that you're talking about and the family situation. And I feel like you are probably the first time I've actually heard out loud, you know what, we're failing in a lot of areas. Certainly around mental health provision, there's been a huge gap in the help that we have received as a family, and therefore thousands of others must have done too, in that CAMHS have not been able to support, and neither have Healthy Minds, and on a number of occasions. And my son's mental health has been severely and significantly impacted upon because of this. And I think that I feel like you have acknowledged that today. So that's why I say thank you, because I feel like the first time it's been heard. And with that, I'm hoping that we're going to have a more modernised approach in how we're dealing with this, and we can start taking some ownership for some of those failures. I do think you are pushing mud uphill a little bit, because, like you say, the voice of Lincolnshire hasn't taken too favourably at times, and I think we're going to have to do a lot to build trust again within the community. With that in mind, I think that the idea of the hub is fantastic. PACT have done a great job. I would never say otherwise at all. I personally have found it a place where people have generally gone to moan rather than to really get the support that we need. I'm not saying that there is a failure in that. We all need people to talk to from time to time, but actually what we need is to get those facts out on the table. Part of that process for me has been who we're identifying as being suitable referrers into the system, with it only being GP or school. These people do not know our children best. We know our children best, and our children know themselves best. And I would hope that we're going to start thinking a little bit more logically about how we can refer and who can be those referrers into the system. Liaise have been great. They are wonderful at what they do, but they are far too slow. Again, this is more of a systematic failure rather than the skills that they have. But having to wait 2 months when your child has been excluded from school or college is not acceptable. The damage is already well and truly happening and on the way. And where does the buck stop there? And finally, my final point really would be around the 16 to 18-year-old provision and what we're doing to support that group of people. I say that group of people because when we're talking about children, the parents are normally the people that are supporting and caring for and advocating for. And when we're an adult, we have now finally transitioned into adult services, and we should be representing ourselves, or we have still got the care in place. What happens to the 16 to 18-year-olds that's struggling? They're trying to stay in mainstream education, not thriving as they should be. They want to be as a not a child anymore, but not quite an adult. Where do they fit? Do they want to go to a PAC meeting where we're typically talking about younger children? Do they fit into that category? Do they feel intimidated if they go and think for adults? I just don't think that there's anything suitable for them out there, and I think they too need a platform to be seen as the young adults that they are, because when we take away autism, when we take away ADHD and anything else, they're just a kid trying to fit in. That's what they're trying to do.
No,
I'll
lots
rest
of
my
points.
case.
No, lots of really good points there. So in terms of PACT, I mentioned them as one. That's the whole reason we wanted the hub. So initially, there were some thoughts about, do we go out to an existing organisation that's out there, any existing organisation, and they take the hub on? Because currently it's going to sit under LPFT. And I think that the co-production group very much felt that there's nothing in Lincolnshire that covers all ages and all areas of the county. So whatever we were going to go with would be quite understandably, because they're quite small, but biased towards a particular age group or a particular area of the county, and that's the reason it's come under LPFT. Sorry. The aim is that longer term it will become its own sort of separate group. It won't sit under statutory. The funding will still be there, but it will sit independently, because one of the problems sitting under the NHS is that there are a gazillion bits of governance that you have to jump through to make anything happen. It doesn't fit with that creative, innovative way of working. It's a lot more fixed. So when you're talking about the children, young people young people more than children, but the 16 to 18 group, absolutely, if that's a gap, then we need to look at what we need to provide in Lincolnshire. When I say we, I mean the royal we, so the whole community. What do we need to provide? And again, what needs to be provided is quite different and quite unique. And so some autistic people say to us, just because I'm autistic, I don't want to go to something that's autism. I want to go actually to a gaming group, or I want to go to I don't know what their interest might be, football or whatever, I don't know. It might be, I just want to go there and then understand that because I'm autistic, I've got some additional needs, as in how you support me, and I want that to be done in a way that makes me don't feel like the odd person or the outsider. So whereas other people say, what I really want is to go somewhere where it's all autistic people, because I want to understand me and my autism better, actually, and what that means for me. So you're talking about a really, really diverse group, and that's exactly what you were describing. All young people 16 to 18 struggle, actually, don't they, in terms of finding their place in the world. These young people struggle even more because they've got extra bits to be thinking about and working through. So the aim of the hub is to, and particularly the 3 autistic leads, there'll be a children, young people's autistic lead who will have lived experience. Their whole purpose is to keep their finger on the pulse of Lincolnshire, what's happening, what does exist, what doesn't exist, and to be the advocate for that particular group of people. Same for the autistic adults, same for the autistic parents and carers. And where there is a gap identified, it's looking about how do we fill that gap, and again, the royal way. So the hub itself, its steering group, will be looking at the best ways to do that. Just to come back to your point about CAMS, I absolutely agree that there is work to be done in relation to how we support children, young people and autistic adults' wellbeing. And I think it is difficult sometimes for clinicians when they're trying to work out how do I support this person? They happen to be autistic. Is it the autism I'm working with, or is it actually the underlying mental illness that I might be dealing with, or mental health difficulty I'm dealing with? So there's something there about getting it right where it's actually underlying mental health, mental illness or mental distress itself. Then we need to make sure we're making reasonable adjustments and we're understanding what that is about, rather than saying, well, they're autistic, so they're going to feel that way. That's absolutely not the case at all. The same as it is, there'll be some people where it is the autism itself, because it potentially is the sensory needs that's causing difficulties in school, and you can't, no CBT approach or any specific approach it's wrong. It's like telling a child, put your finger in fire and it won't hurt, I promise you. Well, of course it hurts, because sensorily autistic children might feel it very differently. So I think it's about being really clear and pulling apart what that child needs and what that family needs. Some of it will be a clinical offer specifically around non-autistic stuff, is the best way I can put it. Some of it is a clinical offer that's specifically around the autism, and some of it is non-clinical entirely. So I think that's where we need to get better, and I'm hoping that as we design this new pathway for assessment, that will help to identify where people need to be. But also very happy, Lucy, for you to be part of those conversations. There's currently an LDA work stream specifically for children, young people, specifically looking at the mental health needs of autistic children and children with learning disability and other neurodivergent needs. So very happy if you're not part of that to link you in.
I'm not, but it is obviously a keen interest of mine, yes.
Yeah, thanks, Emma. I think it would be good if you could contact Lucy outside of this forum and link her in. That would be really valuable. I'm going to move on now, and you're talking really quick, so I know you're getting a bit coffee at the minute, so I'll try not to go on too long. But Emma would like to just come in here with a question.
Hi everybody again, Emma Slack, Public Governor East Lindsey. It's a question and a comment, but it probably might again be better outside of it because there's a hell of a lot I've got written down. But I was just going to say, I think me and Emma have tried to email one another and kept missing one another. So I would like to say I'd still like to be involved on the parent carer expert side of things. And to everyone else out there who doesn't know me, I have got 2 children with autism, ADHD and other things, one with severe learning, the other not. So, I sort of got 2 pathways probably there or something. CAMS I would want to talk about because a lot of, in the past I've run a parent support group, and a lot of what always has come across where, because the child has got a diagnosis of autism, that they won't be seen. So I think, a lot of this has got to change, because a lot of the time perhaps they have got an underlying mental health problem that is, so I think they need to not just think, oh, well, they're autistic, we can't see them. Also, I mean, help for families regarding puberty and hormones and everything, because I think autistic individuals find all of that, it's difficult for any teenager, but I think for those that have additional needs, it actually is more impacting, especially those with a learning disability. I know that firsthand from my son that's going through it right now. Schools, are you going to be involving schools in I don't know quite how, but you know, because obviously they are generally supporting a lot of these children throughout the day, and their awareness isn't always fantastic. So that, you know, I don't know whether that can be included with the virtual hub type of thing. There's all sorts of stuff, but I mean, you know, I don't want to, you know, so I know we've got a lot to go through still. So I mean, if Emma wants to contact me and arrange to meet or whatever, then that, you know, that's perfectly fine. But I do think it's a fantastic piece of work, and well done and everything as well, you know, because it would be fantastic if people and families have all this support, because I do know how it feels to not have it, obviously, from a long time ago.
Yes, thank you for that, Emma. I think what we've got here, Emma, you've got the governors here already developing your clinical and non-clinical offer, which is really valuable, the expertise that they have to give to that. So I think out of this, if we could have an action that Emma, you liaise with Karen or one of the team, so that we can engage the governors in a session outside of the representation committee, because they clearly have a lot of expertise there to link into that, what is a clinical offer and what is the non-clinical offer there. So that's going to be really valuable moving forward, and you know, within that context, probably agree, you know, with the governors what role they have in continuing to support you developing the strategy, but also how that strategy is then implemented in practice. Is that all right?
That's really positive. Yeah, absolutely. I think what I was just to say with that, it will probably not be till September, because what will be really good is when the hub management team are here, we've finally got them on board, they'll be the ones that are operationalizing all of this, so they will be the right people. I'll be there too, because I'll be overseeing it, but they'll be the right people. So be September time, just to give you a heads up. If that's okay.
Excellent. But if we get it down as an action for this committee, it means we can track it and make sure we're involved at the right time. Yeah, lovely. Thanks for joining us today.
Thank you.
Have a sip of water now.
I will do.
Okay.
I kept going, didn't I? That's
you did. Well done. Okay, thank you. So we're going to move on now to Sam and the ILOG report.
Hi again. Yes, the ILOG report. We've actually only got 2 on the ILOG report this time, but they're both covered off. Jackie mentioned about another ILOG that has come in earlier, so that will be put on for next time and will be progressed. So unless you've got any questions, it's just to receive that one as it is. So I'm happy to take any questions from the governors.
Okay, so I'm not seeing anything coming up, so I think we'll just receive that one. And I've got a new message, but I can't actually see it. Oh, question from Emma.
Oh yeah, me again. I'll try to be quick. I know one of the iLogs was mine. And I know it's green now as it's saying it's resolved, but some of it I still think wasn't quite resolved really, in light of what the lady in question was talking to me about what happened. So I just wanted to push forward, because when she rang the crisis team, they just didn't seem to be very helpful on the phone to her at that point, and she was in crisis, and it's that kind of just niggles me still a little bit really, because if the first point of contact person isn't going to be empathy and supportive to try and direct them elsewhere, then we're kind of failing from the beginning. Does that make sense?
Yeah, I think you're right, Emma. If you don't feel that it's a completed action, then we do need to relook at it. So can I suggest that you and Sam have a discussion around it, and what you feel would be required for that to be completed as an action?
Yeah, I just don't quite feel I don't feel that what I've got back from them is kind of really answered what I asked.
Yeah, and that I think that's fine, and I think, you know,
okay.
in that case it isn't closed and we should continue to take it forward.
Yeah, all right, thanks.
Okay.
Absolutely, yeah.
Lovely, thank you for that. And Karen is going to take us through the Council of Governors agenda for the meeting to be held on the 10th of August.
Thanks, Sharon. Karen Scott, Head of Corporate Governance. This is the draft agenda for the next Council of Governors meeting, as Sharon says, on the 10th of August. It's here for information, comment, question regarding anything that's on that. It's taken from the Council of Governors board agenda for the year ahead, plus some additional items ad hoc as and when they're required. It's quite lengthy, but I think it demonstrates very well, probably for the first time I can remember for a long time, that we've got reports from each of the Council of Governors committees. So that's a particular note. And I know a conflict of interest for Sharon, but with Sharon's imminent departure from the organisation, sadly, there are two papers there about the appointment of a new deputy chair and also a senior independent non-executive director. So happy to answer any questions or take comments if anybody's got any, but that is the current draft at the moment. Thank you.
Are there any comments for Karen on that agenda? I'm not getting any, Karen, so I think, you know, we're accepting that as a draft agenda, but if anybody thinks of anything, please send it through to Karen. Thank you. And the final agenda item is, which I've lost, is the magazine. Jo, are you going to take us through that? Or
Yeah, I will do. Thank you, Sharon. Yeah, Jo Walker, Head of Communications. So last but not least, our Better Together magazine that goes out to our membership. The next issue is another print version, so it will go out to all sort of 9,000 members, either electronically if we've got emails, or a print version. It's the one we use to advertise the APM event in September, so that'll be the whole back page. But you'll see from the paper there's actually quite a mix of, there's been lots happen, there's always lots happening in the trust, but actually this last quarter there's been a considerable amount happening with the new ward opening, and also obviously changes around Ashley House and the extended closure of Manthorpe and things. So there's got quite a lot of service change updates in the magazine this time around, as well as advertising the governor elections and obviously the changes in the leadership of the deputy lead governor as well. So as I said earlier, in terms of the outstanding action, we are going to be making sure that the previous thing that Laura wanted included just needs to kind of be slipped in, because that slipped through the net, but will that have room to slip that in? But the content is there and it should be delivered to people's houses the middle of August in terms of actual print delivery. So I'll just pause and take any questions if anybody has anything.
right, I think, Jo, you haven't got any comments or questions on that agenda item, so I think everybody's happy with that. Okay, and I haven't received any other business, so I'll just give you a second to let me know if there is any other business you'd like at the end of today's meeting. Okay. Oh, Bex, you've got a comment.
Yeah, it was just a quick comment to thank you for chairing the meeting today at short notice, but also to thank those people that nominated staff members in the staff awards. I was very lucky to be asked for a second year to actually go back to help with the judging, and it just goes to show there's some phenomenal people working for our trust, because the nominations were amazing.
Yeah, they were. Yeah, thank you, Bex. Okay, so I'm going to bring the meeting to a close, and you for everybody for attending. The date of the next meeting is the 16th of October, and it's at 10 o'clock again by Microsoft Teams. So thank you, everybody.
Thank you.
Thank you very much. Well done.
Thank you. Bye.
Thank you.
Thank you.
Bye.
Bye.